Welcome to Community Talk Radio. This is Project Independent You, Talk of the Town on LIU Public Radio. I'm Kristina Liu, along with Otto Los. I am playing host, producer, and engineer today. Um, really great first hour of our show. We had Nicole Christensen, who is the president and founder of Care Answered, which is a patient advocacy organization, and just incredible source of information. And uh, I certainly made a note to order her book because I think at any age it's really important to have these tools with you, because we all have been there, whether we're caring for someone else or trying to advocate for ourselves. It's really important to prepare for all these things. So
Well,
great
the
show.
gold nuggets, like I mentioned, is the idea of putting your healthcare proxy, giving them access to your patient portal,
Hmm.
um, which I think you can do by just giving them a username and a password.
Hmm.
But
Yeah.
is there something on there that says so and so is the healthcare proxy, or do you actually put the whole healthcare proxy onto my chart? I don't know the answer to that, but
I think it depends on the what the portal is. And I think that's a great point, Otto, because I do know a lot of people that, have to designate the healthcare proxy. So they're like, okay, my daughter's going to be the healthcare proxy. But, the point of the healthcare proxy is to really have all the information. It's not just to check off a box and give a name, because what's really the point of the healthcare proxy unless they're, clued into, your medical history, so they're able to advocate for yourself. So I do think, and I cannot mention enough the importance of an updated medication list. You know, not only, to just have it saved on your computer or print out in your house, but to have it on your person. I keep my mom's in my wallet. And I did the same thing for my grandpa, because you're always in a situation where they're going to ask you what medicine is the person on, and I could barely pronounce the names, let alone remember them. So I think it is so, and to make sure it is updated. We don't want your list from, 5 years ago. We want the most current list. And,
well,
you know,
also, by the way, my what I do with mine, and I encourage that as well, is you should have an overview, a highlight overview of your medical history.
yes.
Uh, hip replacement, cataracts, or
Mm-hmm.
whatever. A highlight so that somebody can look down and say, "Oh, blah blah, you had prostate cancer." Uh, you should have that, because when you're sitting in anybody's office, doctor's office, whatever, you don't remember that stuff.
No,
So it's
Otto, that is
important.
such a great tip, because, that it really is, because, they'll ask you, oh, and you're in this usually in some kind of panic, so you're not thinking and placing all these things, just, and I think it's beneficial for you, and it's so beneficial for your clinician, because, I always laugh, um, going to all these doctors with my mom. If anyone knows me, I really try to be as prepared as possible for her, because it is a very stressful situation. She's a nervous wreck every time we have to go to these appointments. I'm a nervous wreck, but trying to smile through it. So for my own self, having these papers in front of me, and that's what we do. And yes, at the time it might, be time consuming, but in the long run, it's something that I know helps myself, and I'm sure will help other people, because I'll go to these appointments with her since the very beginning, write down. When we come back, we'll sit and talk and kind of recap everything. Of course, I type it out, so we have this ongoing list, and then I'll pull out like the highlights, so this way we have that too, and I made a calendar of when she has to take, the medicine and the off weeks, because it is so overwhelming, all these things. And I personally know, like, it's so important to, whatever you can kind of do to alleviate some of the panic and stress in these situations is so beneficial.
Well, another part of that recap is basic information.
Hmm.
Who are you? Who are the contacts that anybody should call if they have to? What drugstore do you use?
Yeah.
Uh,
Hmm.
and frankly, one that I have is what's your blood type? Uh,
Oh, that's a good one.
all right. Um,
Yeah.
and I do this all on 2 pages.
Mhm.
I'm not talking about writing a book. I mean, you have to make it
Otto
an
whips out his
over.
portfolio.
Well, you have to make it
Yes,
somebody
absolutely.
has to look at it, all right? And if it's too long, they're not going to look at it. And that's unfortunately one of the other reasons you have this is because all this information is probably on the portal, but nobody's going to look for it all. All right.
Otto, and it's
Everybody's too
something.
busy. All
You're right.
right.
It's because, a lot of times, which is great now, right? They say you could fill out these papers, before you get to the doctor, which is lovely, right? It's great in theory, but I feel like somehow a lot of doctors I'm going to, you still have to fill out something, right? And you're like, but I just filled out all this information, already in the portal. Like, oh no, well I got to give this to her, So it's always, some kind of story. But what I did, is what you said, because on it, they'll ask, they say, but to my mom, when was your last mammogram? When was your last pap smear? So you need to have these dates, right? And that's all
Mhm.
part of the highlight reel
Who
and
is your
what you're
doctor?
allergic to.
Who is
Yeah,
your family doctor? What
right,
is their phone number? Who
right.
is your cardiologist?
Hmm.
Who is your urologist? Who is your whatever?
Yeah. I know, and then you sit there like frantically trying to Google
Yeah,
if you're
just have
able
it.
to, right?
And frankly, what
On
I
your
do is
phone.
I say, here you go. It's all
Yeah.
here,
Yes.
and then they'll look and they say, oh, this is great. And they'll look and they'll enter what they have to. And they may
Mhm.
ask me a question, although most of the time I will do it all in advance. But you
Yes.
can't do that if it's an emergency, you know.
Yeah. You're so right, just to have like those basic information, because I really think that that's a great point for, our listeners and for seniors in general, because, you know, I have the ability, right? I have my iPhone, I'm tech savvy, so I could Google. So half the time, I'm sitting there, my mom's like, what's, my cardiologist phone number? So then, I could quickly Google it. But I have that luxury, right? A lot of people, A, are not tech savvy, don't have a cell phone and aren't able to do the Googling. So I think what you're saying is such a great idea, Otto, is to have, yes, you might not have the answer to every single question you're going to be asked, but you can have a good chunk of it, with all those, the highlight reel, which I love that. I'm going to use that one, Otto. It's the highlight reel of your medical history.
I mean, I learned the hard way, like you're doing with your mother.
Yeah.
I was 21 years old. I just got out of the Navy, and I talked about this in past shows.
Hmm.
My father wound up with stomach cancer. I'm an only child. My
Hmm.
parents were from Germany. There was a little bit of a language
Oh
situation.
gosh, yeah.
So I'm the patient's advocate looking back on it. No patient portal, none of that. And,
Yeah.
uh, and a 21-year-old idiot who just got out of the Navy. Uh, so I learned very early, and then my mother
Yeah.
over the years and my father, I ended up being an advocate. And I learned a long time ago, put this stuff down so it's easy when you get there, you know.
Yeah.
Do it
No, it's
handwritten. I
it's
don't care how you do it.
right,
You
whatever
can
the mode is,
handwrite it
something.
if you
Hmm.
have to. Do that, fine, you know, and just have it available so you can have
No,
it
and
in
I
your
think it's
mind.
just the
And
advocacy piece. It's just so important. I think back to, this was pre-COVID. I believe it was, I think it was 2017, 18. I can't even remember now, but my father had to go into the hospital, which turned out it was a pneumonia thing. Then it got worse, then it was a COPD, then he was on this ventilator, and it's like everything was just like snowballing so fast, and I think like he had, I was there with my mom, and my mom was like the ultimate patient advocate, and I laughed because she essentially looked like she became part of like the medical team when they would all come and like discuss what was going on, there would be my mom like in the middle of it because you know there's so much changeover in these hospitals, right? So you're dealing with one doctor one day, another doctor another day, even multiple doctors in one day. It's so overwhelming, and and my mom really advocated for my dad because they were really like throwing in the towel. They were like, I don't know, it's not getting better. It was such an incredibly stressful time, and my mom was just like, no, like she just was picking him because she was sitting there every day with him, and was like, try this. And, luckily, her suggestions, the medical team said, all right, like, let's give this a go because, nothing had seemed to be working. And he got transferred to a different unit. And boom, like that. The next day he was on the, and it was like a shot. It was like, what just happened? We were in this like whirlwind. But if it hadn't been for my mom advocating, and that's why I feel so deeply for people who are alone, who really don't have,
They
the
need
family. And I
help.
think that's why it's so important to, reach out to some kind of patient advocate, or, even if it's not a board certified patient advocate, which obviously is great because they know the ins and outs, is just to build that network. We had mentioned about the circle of support and just how important it is, so it could be someone at your, in your senior group, or someone that's at your house of worship, or just your neighbor. I mean, there's so many different levels of this. And I think that it's important to plan. And I listen, I get it could be hard, right? If you know that you probably don't have that much support, it's difficult to sit there and say, all right, like I don't really have that much support, but I think trying is all we can do, right? And trying to prepare for kind of what we can, because half the time we're going to be throwing something that, came out of, left field. So
Well,
it
we
was
beat
definitely an
maybe
important
beat
segment,
this
I
to
think.
death because we've talked about it in the past, but you just rang some bells again.
Mhm,
Uh, when you are or whoever is in the hospital, a lot of stuff is going on.
mhm.
So what is this stuff and why are you doing it?
Yeah.
Who are you? Keep a record of what's
Mhm.
going on so that you can interact with people and be an advocate and find out, well, what are we looking for? Why are you doing that test? Uh, what is your name? Who's in
Mhm.
charge? Uh, you know,
Yeah.
uh, and you
No,
may
and I
feel
really
like
like,
you're being a
in our
pain,
first,
but it's your, it's
yeah,
somebody's health.
it is. And I think that it's important to take that serious out of, because listen, I've been there. I'm a very non, confrontational person. And a lot of times, I won't like push the envelope on certain things or ask too many questions, because I understand people are just trying to do their job. But a lot of times when you're in those situations, you really need to. And I remember, most recently when my mom, was in the hospital, about a year ago, there was a lot of moving parts. There was a lot of people. Everyone, you were like just trying to get it straight. And it was so important to say, okay, what is your name? What is your role in this? Because a lot of times it's, you'll see someone one day and then you'll never see them again. So you're like, what just happened? I just rehashed this whole story with, so and so. So it really is important to ask those questions. And I think that we really drilled that home in the first hour of our show with Nicole Christensen from Care Answered about advocacy,
Which brings another point, by the way. There shouldn't be five advocates
Yeah,
like within a family. This son
yeah.
comes in, that daughter comes in, this one comes in, whatever. Now all five are harassing somebody because not
It's
every, you're right. I mean, you can't be confrontational.
right.
People are all just trying to do their job.
Yeah.
So try to understand that and talk to them in a good way. But within a family, they should concentrate on who's going to be our
Yes.
spokesperson. All right.
Right.
Who will be the funnel on
It's
this
true,
end.
because, and I think it's so important to establish, and listen, that all goes back into our circle of support, conversation, because I've been there, and, I know everyone has very good intentions, in the family. Everyone cares a lot about the patient. But I certainly in my own family, but it can be so overwhelming, when everyone, it's bad enough. So I'm always, I was like the spokesperson, essentially I would try to give everyone a recap, so I would send when my mom was in the hospital, I said, all right, this is what happened today. This is this. But everyone is trying to help, but everyone's got their own 2 cents, right? So, oh, you should do that. So luckily I'm just getting it because it's frustrating enough for myself. But then I could only imagine if here is this other doctor, now getting it, like saying, well, I just already recapped this with, her daughter, so it really is something that I think boundaries need to be set, a plan needs to be put into motion if you have, that luxury, certainly.
Yeah, and
Because
then
it's
there
a
can be
very
a
tough thing.
communication within the family plan. Either we do a group
Yes.
email or a group text or whatever, and I am the spokesperson, so I will update you whenever there's something to be updated.
Yes. Hmm.
So you don't wind up, well, what's new?
Yeah.
What's new? What's new? You get
Hmm.
14 phone calls, and
Yeah.
the bottom line is nothing's changed. So I'll let everybody know if there's anything new.
Hmm. Yeah,
But this
that's
is
it.
all family communication
Yeah.
and friends, frankly. I mean, a lot of times friends are like family, maybe more so even. Uh, so they want to know what's going on.
Hmm.
And one of the hard things I think is caregiving, who
Hmm.
or being an advocate for somebody who's in the hospital is handling all the other phone calls and
Yeah.
communication that takes place. You kind of have to make life a little easier for
Hmm.
the person who is the spokesperson or the
Yep.
caregiver. So the preparation and the planning is all around. It's not
All
just,
around. No,
you know,
absolutely, Otto.
yeah.
And I just, we've referenced the circle support a bunch of times, and I want to remind anyone listening that you can call 311 or 516-869-6311 to receive either a hard copy of the circle of support, and there's different categories and there's great information in it. Or we also have an electronic version that's fillable, so you're able to, edit it and change as you want. So either way, you can have both, whatever it is, but please call 311 so we can get that over to you, because I really think it's a good tool, to get your brain going and thinking, to really prepare for all of that. So it's important, right? I just feel like it's so funny, Otto. I feel like every topic we deal with on this show somehow comes back to, if you prepare for it, it makes it a little easier, whatever the topic is, and we've talked about a lot of different topics on this show, but I feel like that's always the overarching theme that we come back to is really, just prepare. It seems like, people don't want to do it because it seems like extra work, but in the long run, it's
And that
really,
and attitude.
yep, that's right.
It
So it's
does.
our two key, it's our two
It
buzzwords.
comes down to like there's a little circle and all those basics
It
apply
is.
to a lot
It
of
is, and it's
things.
just, and it's tough, right? I know life can be overwhelming and things get thrown at you very fast. But I do think that if you have these kind of things in action, it really eliminating stress is the number one goal,
Well,
certainly.
maybe we could give a plug to Nicole's book too. Her
From
book is
crisis to
From
calm.
Crisis to Calm.
Absolutely.
Her name is Nicole, Nicole
Hmm.
Christensen. Uh,
Absolutely. And you could always call through on one and we can certainly get you in touch with that. But
and I am
Otto,
going to
we
get
are
the
wrapping
book
up
as
the show.
well. Yeah.
Yep. After the break, Otto and I will continue talking about what's going on in the town of North Hempstead. You're listening to Project Independence and You Talk of the Town on LIU Public Radio.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. You know, those little button things on your phone screen. Just ask your grandkids.
Welcome back to Community Talk Radio. This is Project Independence and You Talk of the Town on LIU Public Radio. I'm Kristina Liu along with Otto Los today. And we are talking about all that's going on in the town of North Hempstead and just our first hour of our interview. And I want to remind people once again that you can watch Project Independence and You and Talk of the Town on the Town of North Hempstead TV channel 18 or 65 on Optimum, or channel 46 on Verizon Fios, and on North Shore TV. The show usually airs at 2 p.m. They've been actually doing both shows back to back, which has been really nice. But you could also get the up-to-date schedules at mynhtv.com. You could also watch us online at the WCWP YouTube page and on the Project Independence website. Next week's show, we have on Tori Cohen, who is the executive director from the Long Island Alzheimer's and Dementia Center. So she'll give us an overview of that. Another great um, community partner of Project Independence. So that will be next week. And Otto, we have a lot of other great shows coming up as well. We have um, February 9th, we have on Tori Cohen. Excuse me, February 9th, we have on Maura Callio, who is from St. Francis Hospital, Catholic Health. She's going to talk about the heart of the matter, keeping seniors healthy. because February is Heart Health Month. So we want to have that segment. February 16th, we have on Shari Baton, who's talking about staying safe in ice and snow and the PI transportation program. And on February 23rd, we have on Ron Fatula, who is going to be discussing 2024 changes in Medicaid and new tax guidelines. So a lot of shows. Once again, if you ever have a topic or a guest that you think would be great for the show, please call 311 and reach out to me because we are certainly open to any suggestions. Now,
You do a good
Otto,
job,
we
my dear.
have, I sent to you we've been talking about it, each week, but the report is finally complete for the 2023 Project Independence end of the year. And I just love to recap it because it's a great time for me to really remind people of all the wonderful services that Project Independence has to offer. Um, in 2023 alone, there was 26,452 service requests just into Project Independence and alone. We actually get this year 49% of all the total townwide service requests that come in to our 311 call center, which is really incredible when you think about it. The town North Hempstead's really big, has a lot of different departments, and the fact that our little department gets 49% of that, and that number increased. In the past, it was like usually, for a long time, we were like 44, 46% of all the calls. And when I was looking at the numbers this year and I said, oh my God, it went up to 49%. I think it really shows, and listen, anyone you talk to, you read, the senior population of Long Island and Nassau County, especially, is really increasing. It was a statistics I saw was like 30% of the population in 2024 of Nassau County is going to be 60 plus. So it's an important thing, and I'm glad to have our little engine that could Project Independence really
There's a
there
lot of
to serve it.
amazing numbers in this thing here. Like Project Independence provided 27,142 rides for residents in 2023. That's a
Yeah,
lot of
Otto is
rides.
referring to our taxi transportation program, which is just incredible. And just so people are aware, the Project Independence Taxi is for, our PI members 60 and over. And it's also, we have disability transportation as well, that, it's for 18 up to 21. And it's such an incredible utilized program. And in addition, the town senior residents are able to take this, to weekly treatments, including dialysis, chemotherapy, different Alzheimer's adult day programs. We subcontract our program with deluxe transportation and all island transportation. The food shopping that we do is free. The medical shopping, the medical appointments are, discounted as well. So it's a really important program. Our mobility manager, who I mentioned will be on in February, actually, is constantly on the phone with different seniors. And because our grant funding, allows us to, provide food shopping and, medical appointments, there's still a lot of other transportation, right? So one of the hurdles that always comes up are more social kind of transportation. So Shari, luckily, can call the senior and figure out the best way to get people to and from different social events.
Another
The,
number,
yes.
Help at Home program,
Mhm.
1,645 people took advantage of that. And if you look at this, gutter cleaning, window cleaning, moving heavy items, these are all things that people can get gratis. Nobody's has to pay for any of this.
No, and let me tell everyone, the TRI Help at Home program is possibly one of my most favorite partnerships in Project Independence. It's a program I've been overseeing for many, many years since I might have been still, an intern at the time, diving into it. And it's a partnership we have with the Rehabilitation Institute. And each student is trained, on the job, right? Because their goal is to, get, an actual career after this. They're supervised by a job coach, and they have varying different disabilities, but they're such incredibly hard workers. The new job coach that we've had for, I guess it's about a year now. I have to give a shout out to Stanley, is a all-star, amazing, amazing man. And I listen to him because he loves the seniors, and the seniors love him and love the workers. And I want everyone to know, you simply would call 311. As Otto mentioned, there's a list of different jobs that you're able to cover. So there's gutter cleaning on the first floor, there's window cleaning on the first floor, moving heavy items, and I want people to be aware. So that's in the town of North Hempstead. The sanitation is subcontracted different private, companies. So obviously they each have different rules based upon, what, giant things you need to get rid of. So if it's a washing machine that you need to get rid of, you need to arrange some kind of special pickup. You could call and schedule with our help at home program, Stanley to come on the day before to bring out the item. There's light yard work. And I want people to know this is very minimal, the light yard work. A lot of times, some seniors will call up asking for, a fall cleanup, looking for landscape services. But this is really for, just a minimal thing. You can't get a big cleanup, and especially based upon your property size as well. Um, the goal is to have the most people utilize the program. Replacing batteries and light bulbs. This is a huge part, because
Mhm.
you take it for granted, right? You just have that smoke detector up there. But, when you're a senior, we're always telling people not to stand on, chairs and these ladders. So what's great is you can call help at home, and a lot of times request a bunch of different things. So many times I'll get a request that comes in and says, I need my gutters clean. I'd like to replace the batteries in my smoke detector. There'll be a whole little kind of list of things. And there's also floor care, which is like some light mopping or sweeping. The
You
number one
just said
request.
something, triggered a
Mhm.
bell here.
Yeah.
You've had the experience, and I'm sure we all have. A smoke detector goes off. First of all, you can't figure out which one it is because that's a sound that seems to be mysterious. Like, is it from this room or that room, or where's it from? All right. And then the next problem is, if you think about the situation, if you're not able and you're by yourself and you're not able to get up and take that thing and shut it off, how long will it stay on before it burns out? So
Yeah.
my point is, maybe people who are alone and at home ought to call the help at home program on a fixed schedule, if you
Yep.
will, uh, and replace all those batteries before the battery starts beeping before it's no good. Because at
Mhm.
that point you are stuck. That thing is beeping and you can't climb up there to shut it off. I don't know how long they stay on, but it could be a long time.
It's
Uh,
no, and it's such a good point, Otto, because and I've also, in that realm of things, I certainly have seen many of family members, with the thing was beeping, they take the smoke detector off, and now it's just, lying on the ground somewhere, waiting for the battery to get replaced. Or if it's going off, if you're cooking, nobody wants to hear it, and it gets removed and never to be put back again. So I do see, which I really like, with this help at home program, you are able to use the program 3 times a year. So that a lot of constituents will, kind of use it seasonally, right? So you'll get your gutters clean and your windows washed, and then, a lot of times you'll see like putting the air conditioner in, taking the air conditioner out, so it's moving the patio furniture out, putting it back. So I want to encourage people to. I love what you said, Otto, because that is something you're able to. A lot of times people call, say, hey, I'm calling just to say, I'd like to get work done in the fall, so keep me in mind. So now the social worker has that, clocked, and they'll be able to put that request in. So it's really such an incredible program. The number one request is always gutter cleaning, that we certainly get the most calls for that. But Stanley is just so wonderful, and he truly cares about what he does and working. And I just hear what he of course goes above and beyond the scope of services to help out the seniors. And in that same realm, Otto, we also have Rebuilding Together Long Island, a partnership with them, Um, Rebuilding is another amazing volunteer organization who there were, retired contractors largely make up the organization, but they go around to repair and rehabilitate the homes of low income seniors and disabled homeowners. They would have a work scope gets made, by a skilled tradesperson. All repairs are performed by them, and it's no cost to the homeowner. This, however, is an income-based program. Um, this year, over it was 30 constituents had assorted home improvements, including grab bars, railings, weatherization, and various repairs. I mean, the difference that grab bars and railings make in the home is incredible. I love getting these surveys back after work is complete and just seeing, the fact that now someone can go down the stairs. They would have it. And then when they're rebuilding, a lot of times they'll go in the house, a request will come in, someone will say, I'd like a grab bar in my bathroom. The social worker will fill out all the paperwork with the senior, then refer it over to rebuilding. Then rebuilding goes in just to make sure, that they're able to complete whatever the task is and see if anything else. And a lot of times rebuilding goes in and notices something that wasn't said. So it'll be, a lot, there was one senior who literally the basement had no railing. So it was like this, game of trying to get down the
Danger,
stairs. What'd you say?
dangerous.
I mean, completely for any age,
Yeah, yeah.
and it's really so, they noticed and they said, listen, they really need a railing here. So then they will do that, and then the weatherization is huge. A lot of times it'll be, these crazy drafts will be going in, and it's something as simple as weatherizing the door or the windows. It's just such a wonderful, wonderful partnership, and it's such a smooth process.
Now, another thing that you have in this report that I really knew that they did a lot, but nurses and social workers, you have a
Mhm,
list in here of what the nurses do. There's a long list of about 10 different items. The
mhm,
social workers, there's a list of 20 or so items. I'm not going to read them all, uh,
mhm.
but if people saw this list, what they do is amazing. Yeah, you need support of almost any kind. You can get a nurse or a social worker from Project Independence at no cost, with no obligation to do anything. All they want to do is help you, provide
No,
you
and
with
Otto,
some support.
we always say the social worker and nurse team, our social workers, we subcontract with EAC, and our nurses, we subcontract with Northwell Health, are just the most incredible group of women who are so dedicated to the program. And we always say those are really the heart and soul of Project Independence, right? They are the ones that are out in the field and getting the calls, firsthand for all these different services. And as Otto mentioned, nursing, they'll do blood pressure screenings, they'll help assist in monitoring chronic conditions, give you a different education, medication management, different referrals to different healthcare services, a lot of healthcare coordination, fall prevention is huge, brain games. And they always have these wonderful health programs they provide through Project Independence. And those are just the overview, right, of services. And then our social workers, do counseling, whether it's bereavement or caregiver assistance, entitlement and benefit connections, different financial counseling, food and hunger, SRs we get, disability resource information, respite care, mental health, different support groups, veterans assistance. It's so many, and that's just our, we're just trying to have it over. We can go on forever on all the different programs, but just in 2023 alone, nursing and social work provided 43,359 units of service. I'm sure that number is even more because they're humble and don't necessarily document everything that they do, because figure a social worker gets calls and a social worker and a nurse gets calls from the call center, so they'll get a service request, or they'll get walk-ins into their office or get telephone calls. And listen, everyone gets stopped everywhere. So they are just the most incredible group. They actually served 2,569 unduplicated individuals, and that number increased almost 500 since 2022. So uh, that's a lot of work. They're very, very busy. And just to get in contact with them is you simply call 311 or 516-869-6311. And you don't necessarily need to know what you need. And that's what I always tell people. You know, you don't have to call with a direct thing. You can just say, like, I need help with this. And I love when, someone will call and say, I need my gutters clean. And then in talking with the social worker, all of a sudden a whole host of other needs come out, and you're really able to get connected to these things, for free. So it's just incredible. But Otto, we're gonna have to dive back into this crazy report in the next segment. After the break,
Hmm.
Otto and I will continue talking all about Project Independence and what's going on in the town of North Hempstead. You're listening to Project Independence and You Talk of the Town on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome to Community Talk Radio. This is Project Independence and You Talk of the Town on LIU Public Radio. I'm Kristina Liu, and my co-host today is Otto Los, and we are diving into all things Project Independence and the town of North Hempstead. Before break, we were just going over the incredible numbers and work that was completed in 2023, talking about our nurses and our social workers and all the great work that they do. And I just want to touch upon, we're always mentioning on this program about the partnerships that we have in the community. And we talked about a couple in previous segments. But I also want to just tell people, in addition to those, we have a great partnership with the St. Francis Cardiac health screening vans that they come around. They go to multiple locations throughout the town. This in 2023, they went to 11 locations. 213 people were screened. 75 flu shots were provided in these vans. So it's just great. The numbers for that program keep growing. And it's one of my favorite programs because if you see the van, you don't need to make an appointment. You just get on the van and you're able to get a brief cardiac history, blood pressure check, cholesterol, diabetes screenings, and a lot of great information. So wonderful, wonderful program. And they will be coming around in March. I think they resume going around the town. And another program that is so incredible and really something that is certainly growing is our Project Grass program. It's the CARE, which stands for Caregiver, Grandparent, Respite, and Support Project. This is in partnership with the North Shore Child and Family Guidance Program. And it's about grandparents who are caring for their grandchildren for multiple reasons. Either the parents are incarcerated, have some kind of addiction, or have passed on, right? So now you have grandparents who it's a new world because now they're not just grandma and grandpa, they are the primary caretaker for this child. And it's usually multiple children. Because I see the claims when they come back in, and it's usually, it could be up to, 5 grandchildren. Like it's really what they do is incredible. And what this program does is just blows you away. So
Well, I have a
22
very good
grandparents.
friend of mine, sorry, but a very good friend of mine who's in that boat.
Mhm,
He doesn't live in North Hempstead,
mhm,
uh, but I talk to him often about it. And the kid has a little bit of some developmental issues.
mhm,
And, they're 5 years younger than me. So
mhm.
it's a
Wow.
tough time to be raising people.
Well, they should call North Shore Child and Family Guidance, even though they're not involved. Are they on Long Island?
They're in Scarsdale.
Oh, Scarsdale. Okay.
Yeah.
Yeah, so it's tough, but this is so 22 grandparents received assistance via person and in person and telephone. Referrals and counseling regarding mental health, different COVID-19 updates, financial technology assistance, self-care, food insecurity, preparedness, There's a lot of check-ins to assist grandchildren with school, and this is what I thought was so important, because a lot of children in school now, well, I should say most, are these portals, right? And a lot of it is electronic based. So this is a new world for the grandparent that, who's used to their, this going to school and you have hard copies of things. This is largely this, and that's how you communicate a lot of times with the teachers. So the GRASS program actually will help, sit with the senior about how to navigate that system. There's different holiday deliveries they did throughout the year. And it's the goal of the program is to raise consciousness and awareness of senior grandparents who have had to take on this role and responsibility of raising their grandchildren. And
It's a
and
terrible
largely,
situation when that happens, because like as a normal parent raising children, that's what you're doing. But as a grandparent raising children, you may be having a problem with the child wanting to know who his mother and father are, if they're known. Uh, they may have addiction issues with their child, which is the child, the mother and father of,
yeah,
the kid you're taking care of. So they got it coming from all angles. They got it from their kids and
yeah.
their grandkids, and
No, and
uh,
what's so wonderful about this program is they work to help both sides. So they'll have, different groups for the, and activities for the grandparents. But then on the flip side, they'll also have, different things for the children, the grandchildren. So it's really such, and when I read these claims, it just brings to life, what the amazing program and services that what they're doing is just incredible, because most of the grandparents, this was an unexpected situation. It was certainly not something anybody was planning for. So now you're thrown into this and you're expected to, know. And we always say this, it's great to, have a close relationship with your grandchildren, but a lot of times it's very hard for people, who might not be, and then you have this, extreme different age differences, and it's a new world, right? So I think it's so important to have this backup and support. So a shout out to North Shore Child and Family Guidance for this just incredible program. Um, we also are partnered, in addition to having EAC provide our social workers, they provide our respite program. So the EAC respite program offers a lifeline to families in North Hempstead caring for an older loved one. You get a free in-home assessment, a screened and trained respite companion, visits with the older adult. It's usually weekly. It gives the caregiver some time off, right, to do things that they need to do, because a lot of times when you're the caregiver, your whole life is centered around caring for the person that you're a caregiver to. Uh, Respite visits help reduce isolation of the older adult, and what's great is that they match, the respite volunteer with, the person receiving the services based upon interest. Last year, they gave out caregiver self-care bags and these animatronic pets. I don't remember, we had talked a lot about that during COVID. They actually delivered that to a lot of these seniors as well. The EAC respite program started off 2023 with 4 really active and involved clients, and now they're up to 10 families they're servicing. And just hearing what the caregivers have said, just some quotes where your agency has been a great support for us. Jennifer brought enthusiasm and warmth during her visits. You found a perfect match for us. I cannot wait for her to come back. So you really think about the incredible work that this did, and the little thoughtful gestures. I remember during COVID they were giving these little like bags of just, self-care and stuff, and they were all these organizations that I'm talking about, we've been partnered with at Project Independence, for so many years. And it's just so wonderful to see the great work, and especially during COVID when everyone was kind of thrown and trying to figure out what to do, all these organizations found creative ways to provide these services. And they lost a lot of volunteers during the respite program, and they're really trying to build it back up. And I want to encourage people, anyone listening, if you want to be a volunteer, there's You're paid, it's a paid volunteer, the respite program. And if you know someone who's in need of services, please call us as well. So you would just call 311 or 516-869-6311, and we could certainly get you connected
Programs
with
like
them.
RASP and this EAC network,
Mhm.
respite program, somebody might look and say, 22 grandparents, this, that, and whatever.
Mhm.
Uh, and when if you try to visualize yourself in their shoes, it's
Yep.
one thing. But then if you happen to be one of those people who are in that boat, getting help is life saving.
Mhm.
It's a brutal situation. I mean, this particular case that I know, I've been pretty involved with. I used to work with this guy for years, and all of a sudden, he's what is he, 82 years old, and he's trying to raise a 6-year-old,
Ah,
you know, with his wife, and it's a different game, Uh, yet on the other hand, they don't want to walk away from the kid either,
yeah.
you know.
No, and that's why, it's so important, and I think that's why I really want to talk about these services, because I want people to be aware that there really are great programs out there, that there are, and to not be afraid to ask for help or feel helpless, because we know we've been there, or we know other people that have been there that are just, don't know what to do, or, how. And I can't imagine being, your friend Otto, who was mentioning that is such an incredibly, I'm 39 years old, and the thought of, now taking care of, a 6-year-old, is just, I mean, on so many levels overwhelming, and I can't imagine for a senior, to be doing that as well. It's just, you know, kudos to him. But I wish he lived in North Hempstead, because then
It's
we'd be able to
shoes you
help
don't
him.
want to be in.
Yeah. But if you are putting those shoes right, I'm a believer, and sometimes, things happen for a reason,
You do
to
what you
call
can.
311. That's
Yeah.
it. You just got to try to do the best that you can. Um,
And
Also on
take
this,
help if you can get it.
yeah, absolutely. And don't be too prideful, right? We said there's services out there, use the help. It's free. If you live in North
Exactly.
Hempstead, sir. Project Independence, but I'm also really proud of, I'm always talking about the Pioneer newsletter on this show, and our monthly email newsletter. So the Pioneer newsletter, that comes out twice a year. We were able to actually have the list updated this year, and over 58,000 households. So of course a household could have, multiple people in it, but only one comes to it, obviously for cost reasons, was mailed out. And there's so much information in it. There's really great timely articles. In addition, it's a lot about our programs and different events that are coming up throughout the town of North Hempstead. So if you are not receiving it, always just call 311. I laugh because a lot of the phone calls I receive with people saying they're not receiving it is they actually are. They just think it's coming out more often than it really is. We wish we could send it out more, but it's only twice a year. But our monthly email newsletter, which I'm very proud to say, at the end of 2023, we were up to over 5,000 people signed up for it, which is huge. I remember when I first started it a few years back, I had a very small little amount of people on it. So the fact that it's grown to this, and what's great about the email newsletter is you don't need to just be a senior to receive it, which is just really, really wonderful. So what's really great about the email newsletter is that you get it monthly, as I said, and you just call 311 and you get your email added. You can be a professional, you could be a caretaker, you could be just interested in what's going on in Project Independence. So please sign up for it. It's a great, great tool. Everyone at my job calls it the Bible. They print it out and have it at their desk, because we certainly get a lot of questions. And it's not just Project Independence programs that are available in it. You're able to get, all different events that are going on in North Hempstead. So please sign up for that. It's a great, great tool. And then just in addition, I mean, we can go on and on forever. Of course, our Project Independence radio show is featured in there. There have been over 1,163 non-repeated different shows throughout the years, which is just incredible. Uh, and the exercise program, of course, there was over 10,000 views of our exercise program virtually on YouTube, on North Hempstead TV. On average, over 300 seniors participated each week, which is just incredible. And it's really nice because, for so many years since COVID, we either couldn't have it during COVID. Then as we were coming back, we could have space was tight, we couldn't have as many people, but we're really back to a full capacity rooms, and just seeing how people not only are in exercising and feeling good, but the socialization component of it all is just incredible. And Rebecca Miller, who is our host usually, is very involved in this. And as I drop my paper, I want to remind people that the exercise classes, you can
You're
actually
allowed to drop your
register.
paper, by the way.
What'd you say?
You're allowed to drop your paper.
I know, well, please, I'm surprised I haven't completely dropped more papers there. If you only saw my table right now. So January 30th, registration starts for the 2024 classes. They fill up very, very fast. Please note you are only able to take 2 classes, but you could also do the Yes We Can Friday classes as well. And just some of the types of classes: there's yoga, there's line dancing, there's low impact aerobics, chair fitness, Tai Chi, Dance for Fitness, Gentle Fitness. They're all throughout the town. There's in Port Washington Adult Activity Center, Clinton G. Martin Park, Camera Park, Yes We Can Community Center, Tully Park, Roslyn Community Center, Fusillo Park. Just so many classes. And there's different waiting list, obviously, as well. And as I mentioned, you could watch it, supplement it with the online classes that we provide too. So once again, registration starts 10 a.m. sharp, January 30th. And we're all like waiting for all the calls to come in, because that's usually a flood of calls that day. So once again, you call 311 or 516-869-6311 to do that. So really just amazing stuff. We're gonna clearly talk about this every week. We'll recap some of it. I know Beck wants to dive into it when she's back too. But it's just shout out to everyone that is part of Project Independence. That's from our staff to the people who partake in our programs, our advisory, meeting team. It's really a great network. And a shout out to the Town North Hempstead supervisor and town board, right? They are a piece of the puzzle too, because they are such supporters of our program. So it's like, the big circle of everything that makes Project Independence what it is. And in 2024, I'm looking forward to scheduling more things. We're really I'm currently in the process, and hopefully I'll have updates soon, of getting the smart technology van to more locations throughout the spring. It was a great program
Without
that
management support, you have problems. So we luckily have management support, which is
absolutely
from the town supervisor on down, and I think that's critical. If you didn't have that, it would be
no, and that's what I always tell. We've met with a lot of towns throughout the throughout the years, and they say, "Oh, how do we do this?" And I said, "Listen, it's not easy, right? You need support for everyone." But once again, stay tuned every week. We'll give you all the updates about different programs that are going to be scheduled. And Otto, we are at the end of our show. So thank you everyone for listening to Project Independence and You, Talk of the Town. Otto, we will see you next week. Project Independence and You is a production of Long Island University Public Radio. Dan Cox is our engineer. Join us again next Friday at 10 a.m. on LIU Public Radio. We will, but we'll see you and listen to us next week. Take care.